Well, as the NHS faces the challenges of becoming a 21st century healthcare system, digital health and the unleashing the power of data at the heart of our health system are absolutely essential for that challenge. Data and digital for individual care when you go to a doctor or a hospital. Most of the equipment that is used to diagnose you and to treat you is digital, as you'd expect. It's data and digital for system performance. This is the 5th biggest organisation in the world, and in the light of the Francis Report and all the developments of modern medicine, in order to track treatment, to identify best practice and worse, and to drive up the standards of healthcare and patient safety, we need an intelligent organisation that can measure performance, just like citizens take for granted in just about every other organisation and walk of life. And thirdly, it's data and digital for research, using the power of the NHS, vast anonymised data sets, the world's biggest healthcare system, allowing us to work out which treatments are working in which patients, to design new drugs that are better targeted, and to work out how we can prevent disease rather than have to deal with the costs and the misery of experiencing it later. So it's data and digital across the NHS. And I think this goes right back to digitalising the core values of the NHS. Nye Bevan today would be evangelical, because it is actually in the digitalisation of healthcare that we give modern expression to that core value at the heart of the NHS, pooling our resources to treat disease today and prevent disease for tomorrow. I think the other dimension to this is patient safety. We've seen after the Francis Report huge and rightly public interest and interest across the NHS in making sure we can identify best practice and worst practice and drive it out of the system. And I think a lot of people will be shocked to discover that the NHS runs still largely on paper and cardboard records. I recently went to my local hospital in Norwich, a very modern hospital. All of the patient records are collected by volunteers in carts and taken in a van to a warehouse repository, 10 miles of shelving. That's where your records are, on treasury tags, held together by paper clips. It's no way to run a modern healthcare system. And I think when people understand that that is how we're relying at the moment, that is the system on which we're relying, they will ask, well, why on earth aren't we using the reliable systems that are used everywhere else? And when you think, if you have the misfortune to require an ambulance, when the paramedic arrives from the NHS, I want them to come to you with an iPad, with your blood group, your allergies, your preconditions, and your drug ready prepared, not a biro and a piece of paper. And it's about, I think, helping to explain to people that patient safety in a modern healthcare system is fundamentally linked to our ability to understand the patient's prior history, prior condition, and to measure and monitor the impact of different drugs and treatments so that we can improve and we become an intelligent system. That's key to both safety and care. So the most important priority of all is to make sure that patients and the public trust and understand the use of data in the system. So we absolutely have to safeguard your personal, private healthcare information should remain just that. And although the system has to be able to use anonymised information about which millions of patients here and have had this treatment and the outcomes, your own individual, private, detailed healthcare information must remain so. And that's why the Secretary of State and I have taken numerous steps. Last week announced further steps. Dame Fiona Caldicott, the patient guardian, we've asked her to review the mechanisms for ensuring patients can have total trust in the confidentiality of their personal data. But equally making sure that if you're an NHS user and patient, there's a contract clearly understood that anonymised data for the performance of the health service will flow. And we need that in order to actually run the system. So patient confidentiality and trust is key. And I think the other thing is, for too long, this debate has been led really by the health providers, by politicians, bureaucrats, civil servants in the system. We have to fundamentally shift it to being something driven by patients. By putting power and information in the hands of the patient, we actually change, I think, healthcare from being that 20th century model, something essentially done to passive patients, all too often very patient, by a benign health state, to modern 21st century healthcare citizens, enabled, informed and empowered to take much more responsibility for our life choices, for our healthcare outcomes in this very exciting world of 21st century healthcare.